My name is Ann Mason. I'm from Atlanta, Georgia. And in December of 2017, I was diagnosed with oropharyngeal squamous cell carcinoma. The primary tumor was in the base of my tongue, which is actually down in your throat. It was so small it was barely perceptible on a CT scan, but I had large lymph nodes where it had metastasized, so that's how I knew that something was wrong. I did traditional medical treatment for that. I had the tumor down in my throat resected. I had 29 lymph nodes taken from my neck in a radical neck dissection, and then did 70 gray of proton beam radiation. And I finished that just a little less than 3 years ago. Then this fall, in October of 2020, I was diagnosed with a recurrence. It was in just one node in my neck, in the very place where they had taken all the lymph nodes out and where I had had the most radiation. So needless to say, it was upsetting, surprising, really surprising, and devastating. So the course of treatment that was recommended for me at that time by my surgeon who had done the initial surgery was completely frightening. The lymph node that was enlarged at this time was partially wrapped around the carotid artery. So in removing it, they would need to remove the carotid artery. And it would also either damage or they would remove, I'm not all that clear on that, the nerve that operates or allows you to swallow and to speak. So in having that surgery, I'm at risk for stroke for the rest of my life because they've taken an artery. I've lost the nerve that allows me to swallow for a minimum of a year, and I may never speak with a full voice again. In addition to that, they wanted to take the pectoralis major muscle, pull it up into my neck area to recreate a normal looking neck. So needless to say, this was a huge surgery that we were looking at, and I just didn't feel good about it in my gut. And so we set about looking for other options. I kind of opened the doors and said, I have to look at everything that's out there. So we had at least a half a dozen, maybe 8 or 9 consults with people all across the country. Some were traditional medicine, some were alternative, some were integrative. Every traditional doctor told me the same thing. It was surgery first, then chemo, probably not radiation because I'd already been irradiated, so that typically doesn't happen again. I just didn't feel like that was the way for me to go. So I kind of canceled those ideas out. I looked at alternative, and I just didn't feel like there was enough science behind it. I'm a fairly practical, nuts and bolts kind of person, and I just didn't feel like I had the comfort level with that. I felt where I needed to be was kind of in the middle, where there's some good science, there's some good parts to traditional medicine, but then there's also some other things that aren't yet incorporated in traditional medicine, at least not in the United States, that I felt like had value. So that's how I found integrative. In terms of how I found Dr.V specifically, it's kind of funny. I mean, it's just one of those coincidence after coincidence after coincidence. I got introduced to a friend of a friend who's been fighting cancer for 11 years. She was part of a Facebook group that I joined. And in there, through conversations, I met a current patient of Dr. V. I was in Arizona looking at an alternative doctor at that time, and she said, "Why don't you do a consult with Dr. V?" And I said, "No, I'm done. I've been doing this for 3 weeks. I have to deal with this or I'm going to die. I can't just keep looking at more and more and more options. I have to make a decision." So I told her no. And then my gut said, "That wasn't a coincidence. You need to do that." So I looked at the videos on Dr. V's website. What she had to say completely and totally resonated with what was in my heart of what was right for me to do. So we scheduled the consult, and a week later I was here. You know, really, it was one of the videos. I think it was her just talking about integrative medicine, of, you know, taking the best of this, taking the best of that, and combining them with an open mind. You know, let's not limit our choices. Let's be selective about the modalities that we're choosing, but let's not label it as traditional cancer treatment or alternative cancer treatment. Let's use it all. If anything applies, please, let's use it. So that's why I felt like she spoke to my sensibilities, you know, that just being open and looking at anything that felt like it was right. I'm good. I'm so good. I was getting regular ultrasounds here under Dr. V's care to keep an eye on the flow of that carotid artery, the blood flow, to make sure that the lymph node wasn't compressing on that too much, because then I'm at risk for a stroke. So after 2 weeks here, it was fairly similar to what it had been on the CT scan before I got here, just a smidge smaller. 2 weeks after that, so I've been here for 4 weeks at that point, it's gone. Yeah. Gone. There's another lymph node that's visible, but it doesn't look cancerous, and it's in a different location. But the one that was going to kill me, the one that was on the artery that was going to cause me to have this completely life-devastating surgery, is gone. I can't really wrap my head around it. But I'm so glad I didn't do the surgery.
That's the one thing that I'm sure you'll be processing this for a while.
It's a like minute by minute struggle for me, because I still feel different on this side than I do on this side. So my head is always playing games of, it's not really gone, it's coming back. We had to do 2 ultrasounds before I would believe that it was really gone. I couldn't believe it based on the first one. So we waited a week and a half the second time before getting another ultrasound. And I took pictures of it that time, so that every time the doubt came back into my head, I could look at the picture and see it for myself. All the time. And I'm so glad that my gut spoke to me, and I'm so glad that I listened to it, because I have 2 kids, and all 4 of us, my husband, myself, and the 2 kids, all had this same really strong gut feeling that the surgery wasn't the right thing to do. But in my head, I'm thinking, is it because it's so extreme and it's going to be painful and life-altering and I just don't want to do it? Am I being a wimp? Is that why I have this bad feeling? Is because I just don't want to do it? And actually, my kids were the ones who told me, no, Mom, the brave thing is to do something different. The safe thing is to do what conventional medicine is telling you you have to do. So they really encouraged me to listen to my gut and not feel guilty for going against what so many doctors were telling me was my only hope for life. I don't think anything in particular for my type of cancer, other than with my kind of cancer, the treatments in conventional medicine are rather barbaric. So maybe it just is an additional push to question the way things are done traditionally, be open to looking for other options, listen to your gut, and maybe don't rush into making your decision. My surgeon was calling me weekly to tell me that I was running out of time. And he gave me 9 to 12 months to live when he gave me the recurrence diagnosis. And then the reminder calls weekly would come of, we're running out of time to do this surgery. It was pretty intense. It was a constant reminder of death. And quite honestly, I just couldn't take that anymore. And that's part of the reason I shut the door on conventional medicine, is because I couldn't handle hearing you're going to die on such a regular basis. And I really felt that there was another option. So yeah, I think probably the biggest thing is look around and trust your gut.